Assalamu alaikum students and a very warm welcome to Medico Pharmacy Doctor. This is Ashraf Hussain, your lecturer of Doctor of Pharmacy, second Proff, Pharmaceutics Dosage Form, second chapter. The topic we are going to discuss today is the need and advantages of dosage form. Before this lecture, watch lecture number 1, that is about the introduction to dosage form. We discussed medicines, drug, and pharmaceutics, that is the subject. We also discussed about the definitions of pharmacy and the composition of the dosage form. So now today we are going to discuss about the need and advantages of dosage form. Why it is necessary that we should have a dosage form, means the medicine form. There are two reasons why it is needed. The first one is the drug safety or the benefit. It involves the improved bioavailability. And the second one is the targeted delivery. Improved bioavailability. What does bioavailability is? Bioavailability is the rate and extent of the drug action in the body. The second one is the targeted delivery. Targeted delivery means that it can improve the efficacy through passive transport, through active transport, through site specific and cell specific delivery in the body. So that is essential that we should have a dosage form so that there are drug stability, safety, and it is beneficial for a drug to show its action inside the body. The second one is the patient safety. Why it is necessary? It is necessary to enhance the patient compliance and to reduce side effect. We should have minimum adverse effect and maximum therapeutic effects in the body. Now we come to the main topic, that is the advantages of the dosage form. The first one is the safe and convenient delivery of the accurate dosage. So the drug should be in the accurate form. It should be safe. It means the active pharmaceutical ingredient with it, the excipients are added, that they are safe, that they are convenient, that they are easy to deliver inside the body, that they does not show any toxicity in the body. Examples like syrups, tablets, capsules, suspensions. So it shows that the drug should be in safe form. The second one is the protection of drug substances from gastric acid after meal. Now this is one of the most important one. Several reasons, because some tablets, some capsules, even they can cause irritation in the body, so they are protected. They are protected in order to resist the dissolution in stomach, because they are destroyed by the acids present like hydrochloric acid. Even pepsin can also destroy drug substance, so it will show less activity. Means that the first fast metabolism should not be highly observed in the stomach. It should goes to the liver, it should goes to the other parts of the body to shows its action. So it resists the dissolution in stomach. So it releases the active ingredients in the intestines because there is less acidity. Now the third one is that it will prevent the irritation and ulcers. So such drugs which delivered to the GIT, mostly they causes the irritation. Even peptic ulcers can occur. Duodenal ulcers may also be caused. The examples of such drugs includes are aspirin, naproxen, and ibuprofen. Now students, so the examples of such drugs includes the enteric coated tablets. Such drugs will be enteric coated. Enteric means that they are protected from stomach, but they will go and release their active ingredients only in the intestines. Now student, the main reason that these tablets are coated is that the physiological pH highly affects the absorption of drug. Why? This is the reason that in acidic environment, the acidic drugs are stable and they are uncharged, while the uncharged drugs are water insoluble and they are lipophilic, the weak acidic drugs. Weak acidic drugs are mainly exposed to the basic environment, so they are charged, they are water soluble, they are hydrophilic. So they cross the cell membrane through the aqueous diffusion. The pH of the acidic drug ranges between 1 to 6. That includes the phenotine, thiopentone, and aspirin. Now student also remember this point, that if the concentration of the ionized drug is equal to the concentration of unionized portion, so pH of the body, that is the environment, will be equal to the pKa of the drug. This is one of the most important point. It means that the 50% drug will be ionized and 50% of the drug will be unionized. Also remember this point, that in stomach, when the gastric time is reduced, the absorption of the drug is reduced. So when gastric time increase, the absorption will be increased. Such is the best example for cholinergic drugs. When in intestine, the gastric time increases, the absorption will be decreased. If the gastric time is reduced, the absorption will be increased. So there is a difference. In stomach it is different, while in intestines it is different. Now we come to the environmental factors that is important for the dosage form of the drug. The drugs are protected from the atmospheric oxygen, that is oxidation, and moisture, that is hydrolysis. So such drugs are protected in the amber bottle, so that light cannot affect the solubility, the stability of the drug. And from moisture basically it hydrolyzes, it degrades the content present in the drug. It may reveal the drug to microorganisms, so it enhance the growth of microbes. Therefore such drugs is protected from the atmospheric oxygen and moisture. For this purpose, in many drugs the preservatives are added. So the example include are the coated capsules and the sealed ampoules. Coated capsules are basically the oral dosage form, which masks the taste and odor, and that improves the bioavailability. Now, sealed ampoules. Sealed ampoules are basically the small glass container that contains the liquid sample which is preserved. It is a solutions that provide stability and prevent the contamination. So the growth of the microorganisms is prevented. Fourth one that includes that it masks bitter taste or the odor of a drug substance. Masks means to prevent, and odor means the smell. You know that excipients, different excipients are added. Most of the capsules, you can see that gelatin is used, that covers the capsule, and syrups, the flavored syrups or the non-medicated syrups, that are sweetened viscous liquid, cough syrups, antacid syrups are used. Now one of the greatest advantage of the dosage form is that it provides that the liquid preparation which is insoluble or unstable in the desired vehicle. What does it mean? It means that when a liquid preparation is prepared, such drugs, they are unstable. They are unstable in the provided vehicle or solvent being used. So it provides the specificity to prepare a liquid form of dosage. It includes like suspension, emulsions. In suspension we have one of the best example, that is Pelton V. Pelton V is, that is basically anti-emetic. Anti-emetic means that it is used against vomiting. Now the sixth advantage is that the preparation of drugs for inhalational therapy. The drugs, they are converted into the dosage forms for inhalational, that is the medications through breathing, maybe include the meter dose inhalers, even powdered drug dose inhalers. This is one of the best advantage, that even a person having respiratory disorders, So such drugs can be prepared for the inhalational therapy, such as the albuterol that is used for the asthma treatment. These are the drugs used in the medication of the respiratory disorders. Now, the seventh most important advantage is that the insertion of the drug into one of the body's orifices. Orifices are basically the passages or the openings into the body cavities. That includes the rectal and vaginal suppositories. So these are the delivery of the medication for a locally or the systemic effect. Now student, if a medication is used for a rectal purpose, it includes like sometimes we have the problems like constipation, hemorrhoids. In vaginal it can be used for yeast infection, means mostly antibiotics are used. Yeast infection may be caused by the yeast known as the Candida albicans. Urethral are very rare, that includes the erectile dysfunction. So such medications are maybe solid or semi-solid dosage form. The eighth one, that is the optional drug action for the topical administration. Now for local effect. For local effect, such drugs includes the ointment, creams, and nasal preparation. For topical, for topical purposes, it may be locally or it may be systemic. Even one of the example was that in ointment we used glycerol-trinitrate GTN, which was used for angina pectoris to treat the chest pain, but it has a prolonged action. It has to cross the skin layer. The scopolamine was the first FDA approved transdermal drug delivery system, which is used as a transdermal patch. Even creams, even nasal preparation, these are used for the topical administration. So these all eight are the basic advantages of dosage form, which we have discussed today in detail. I hope student that you will like the video and will share it with your friends. Also give me your feedback and suggestions in the comment box. If you have any query, you can ask anytime. Thanks for watching. See you in the next lecture. That will be the classification of dosage form.